President Trump was discharged from the hospital and flew back to the White House.
And some of his behavior during his COVID-19 battle is troubling to some infectious disease experts. From leaving the hospital while still contagious to wave to his supporters, to ripping off his mask once he was discharged from Walter Reed Medical Center while still battling the disease.
So much about coronavirus. And one thing that's for certain, don't let it dominate you. Don't be afraid of it. You're going to beat it. We have the best medical equipment. We have the best medicines, all developed recently.
News 3 This Morning anchor Jessica Larche spoke with a UVA doctor who helped develop many of the treatments the president is currently taking.
And he says now is not the time to be cavalier about COVID-19.
The president mentioned therapies being developed for COVID-19, some of which he received. And I will say, and being involved in the development of some of those treatments, that these really are great advancements that we've made in being able to treat people. All the same, the risk really remains. In the study of dexamethasone, for example, that the president received, about 23% of people who received dexamethasone in that study died. So we're still talking about a really risky virus if you're sick enough to get hospitalized. So even though treatments are an incremental advance, it certainly is not a license to be irresponsible in terms of protecting yourself.
I was very concerned when I saw the president leaving Walter Reed while still battling COVID-19. And then we see him, take his mask off as well while still infected. What was your reaction to seeing that as an infectious disease expert?
I was also very concerned by that. We know that members of the White House staff have come down with COVID-19. It sounds as though the White House may not be engaging in contact tracing as rigorously as would be recommended. And certainly one would expect that the president continues to be able to infect other people at this point in his disease course based on the publicly available information that we have. So certainly if I were discharging a patient, I would recommend strongly that they continue to isolate themselves, that they wear a mask when they have to be out in public, and to minimize being out in public as much as possible.
There was a moment where the president drove around to wave hello to his supporters. Obviously, he was not in direct contact with the crowd. However, there were Secret Service agents driving him around. And that also made me uncomfortable seeing someone who is known to be infected with COVID-19 around other people who are not medical professionals in that moment. What was your reaction there?
Yeah, when we go into rooms with patients who have COVID-19, which are larger than the inside of that vehicle, we wear full personal protective equipment. We wear N95 masks, we wear gowns, we wear eye protection as well. And we also try to minimize the number of times we go into those rooms. We only do it when we need to perform a service for the patient, when we need to check on them, and we don't go in just for fun. Every time that you potentially are exposing yourself to a person who's infectious is a risk to you. And so I think everyone who is in that car was subjected to a risk of infection. Hopefully they were able to minimize that risk by wearing appropriate PPE, but even so, that seems like an unnecessary risk to run for them and for their families.
A part of the messaging that's going on right now is not to fear COVID-19, don't be afraid of it. I find that hard to swallow for those who have lost loved ones, the 200,000 people who have died, or people who've had severe COVID complications. What is your message to the American people about COVID-19, where we are right now in fighting this?
I don't know that there's any benefit in being afraid, but there is benefit in taking a look at reality and taking appropriate steps to protect yourself and your family. I'm not afraid of driving my car, but I also know that people die in traffic accidents. And so I wear a seatbelt and I pay attention to the speed limit. More than 200,000 Americans have died from COVID-19. More than 5 times the number of Americans who are going to die this year in traffic accidents. And so I think it makes sense to take reasonable steps to protect yourself. Things like wearing a mask, practicing social distancing, avoiding situations in which I might infect other people or other people might infect me. That's not about being afraid or being dominated by fear. It's about taking a look at the real world and making a rational decision about how you can keep safe. UVA was instrumental in the major trial that put remdesivir, essentially made that available for people in the United States to use that drug. So I feel like we know quite a bit about how to use these therapies, even the experimental ones that the president received. I certainly have prescribed them for my patients and would still say that while I think they're a great advance and I'm very encouraged by the state of the science, certainly, if you get hospitalized with COVID-19, it is not a great situation. We still have patients who die from this disease. We have patients who are in the hospital for a prolonged period of time and may have kind of negative health consequences in the longer term that we don't yet understand. So these great therapies are impressive, but certainly they're not a reason not to wear a mask or not to practice social distancing.